Good evening, everybody. I'm Dr. Sushama, practicing in Chennai, Nungambakam for the past 30 years, consultant, family physician, and a diabetologist. And I see a lot of gastric patients. The topic is on difference between gastritis and GERD, gastrointestinal reflux disease. Gastritis is only a disease of any patient coming with pain in the stomach, we tell that they have gastritis. But gastritis is the inflammation of the lining of the stomach. Gastrointestinal reflux disease is a condition in which the stomach acid repeatedly flows back into the esophagus, causing esophagitis and reflux esophagitis, as it is irritation of the lining of the stomach. Many of the patients come with symptoms of acid reflux now and then. However, when acid reflux happens repeatedly, it is seen to cause GERD. Some of them have discomfort because of this GERD. They come with symptoms of heartburn, like upper belly pain, chest pain, and then there's some throat swelling, which causes dysphagia. And then sometimes they have a sensation in the throat. Sometimes there's a nightline acid reflux. Now, this causes ongoing cough, and there's inflammation of the vocal cords, which is laryngitis. And then sometimes they develop a newer worsening asthma. When such conditions come, then you may have to go meet the doctor. So usually these patients, sometimes with their lifestyle changes, they become okay, but some of them don't become okay. It keeps on coming, so they go to the doctor. Now, these symptoms can come often. Sometimes it goes away just like that. Now, when it keeps coming often, more than a week or maybe a month or so, then they have to see the doctor, because these sensations may cause symptoms like a heart attack, wherein they'll have a severe shortness of breath, and then there'll be a jaw or gas, which goes into the arm or to the jaw, which they may think it is heart attack. The causes of this will be frequent or reflux, acid content going into the stomach from the stomach to the esophagus. Now, the risk factors are conditions wherein these conditions that increases the GERD are obesity. Usually they are so fat, and then there is a bulging of the top of the stomach. Disturb the diaphragm, causing hiatus hernia. Then it can occur, the risk factors can be even during pregnancy. Then there can be some connective tissue disorders which may cause scleroderma. And then factors that aggravate this acid refluxes will be smoking, taking large meals at odd times, that is very late night, eating too much of fatty fried food, drinking beverages like coffee and alcohol. And sometimes patients, due to some pain in the knee, arthritis, although they keep taking tablets like the NSAIDs, which can cause gastric acidity. The complications of GERD are they have this may cause inflammation in the esophagus, which can cause esophageal cancer. And sometimes there is inflammation of there is narrowing of the esophagus, which causes esophagitis. So sometimes due to these symptoms which continue for more number of days or months, it causes a chronic reflux, gastric reflux. The acute one can be treated immediately. The chronic with medicines, but the chronic the patient may have to go in for surgery. Now, the difference between this gastritis and gastroesophageal reflux diseases, gastritis is only the lining, which is not much, but it can cause peptic ulcer or duodenal ulcer, and sometimes it can reduce due to when you take food, or sometimes when you don't take. There is a history of vomiting, too much of vomiting. Sometimes they have too much of blood in the vomit, and sometimes they may have even black stool. These are the times when the acid secretion is more. Now, when it comes to gastrointestinal diseases, that is reflux disease, there is these symptoms may be there, but it will be for a prolonged period. And then the patient has to go in for medication immediately. Now, the medications can be omeprazole, ramiprazole, or pantoprazole. But here, omeprazole with domperidone, because there is very heavy vomiting will be there. And so because of this, we give them omeprazole. And now I've been using Ome's D from the Reddy's lab, which has been very effective all these years. I've been using it, and patients have been happy about the symptoms. My experience with gastric patients are that it is usually that they don't take their food on time. Usually, especially the IT people who they have their different timings of work, so they take the food at late hours, don't get the good food. That is, they take hotel food, they take fried items and all that. So there is an increase in GRD. And this can also cause later on gastric problems, which can cause cancers also in the stomach. I have been getting cases of stomach cancers because because people have not been taking the food at the right time. And sometimes the oil does not, the fatty and fried foods especially. They take biryani and they take all those fried chicken and all these things. All these type of food does irritate the stomach. Then taking food at the right time is very important. Whoever it may be, whether being a diabetic or a hypertensive patient, whoever it is, they have to take their food at the right time. And why I say this is because the next thing is smoking. Smoking also causes too much of cancer in the stomach. Taking alcohol, though the alcohol affects the liver, the stomach is the first one which gets affected. That is the place where the lining of the stomach and the esophagus which gets irritated, and there is reflux esophageal, the backflow of the acid, whatever it is, food or acid or whatever it is, that causes reflux esophagitis. This again shows in the intestine later on, wherein the disorders, the combination of esophagus and omeprazole and domperidone has been very good, because the omeprazole acts on the proton pump, and the domperidone helps in the disturbance of not to disturb the lining of the stomach. The Reddy's lab also has Omes-O, the solution. Antacid is very good. The liquid is very good actually. Even in a case of heart attack or chest pain, they come with, the first thing I give is Omes-O 2 teaspoons with the immediate effect of the medicine. Then after that, then only I go send them for the ECG or whatever it is to see what it is, whether it is a ordinary chest pain or is it a heart attack. So these are the things I've been doing all these years. And I think it has been good. The omeprazole-domperidone combination has been good for quite some time, and the patients have been happy about it. Esomeprazole with domperidone has been good. That is what, when the acid reflux happens, and when the medicine we give for them, when they come with repeated acid reflux, I start with it. But then if it doesn't act later on, then I send them for surgery. The next thing is to send them for surgery, because I give it for 3 months. The medicine is given for them for 3 months. Most people manage the discomfort with their lifestyle changes or with these medicines. Though it is uncommon, but then when it really doesn't work, we have to send them for surgery.